Hi Vet Tech students, this is a video about suturing. So before you get started, take a look at your suture. Is it absorbable or non-absorbable? Is it multifilament or monofilament? And what size is it? Let's look at the example that I have here. Its name is 1 krill, which is a polyglycaprone 25 suture. It's an absorbable monofilament suture and the size is 3/0. Now look at the needle. What shape and type of needle are you using? In this example, it is a reverse cutting needle. It's curved and it makes up 3/8 of a circle, so it's just under a half circle. It's important you understand different types of suture material, the sizing system, the uses, benefits, drawbacks, and which sutures are more likely to cause a reaction. Hold the needle driver in your dominant hand with your thumb and ring finger in the rings of the instrument. Your second and third fingers should drape around the shank and the top of the rings. This position gives you the most power, control, and finesse. When holding a needle, the ratchet should be locked. Grasp the needle in your drivers approximately 2/3 to 3/4 the length of the needle toward the back end. For a right-handed person, the needle should start in the orientation demonstrated here. This would be reversed for a left-handed person. When learning how to suture, start with your incision model horizontal. Line up your needle drivers over the incision. I'm going to call this your base position, and you will return to this orientation as you take bites through the tissue and as you tie your knots. It's important you use your wrist to rotate in a circular motion as the curved needle goes through the skin and out the other side. My preference is that students do not grasp the incision edges with a thumb forceps, because if you squeeze too hard, you will cause tissue necrosis and increase the risk of dehiscence during the recovery period. If you need to grasp incision edges, be aware that you need to be very gentle. Once the suture has passed through the incision, pull it most of the way through, leaving only a short tail for your knot. Do not grasp the suture itself with your needle driver or other surgical instrument, as this will cause damage and weaken the suture. Use your hands. They're more gentle. Keep your hands and needle drivers below your shoulders as you pull the suture through an incision. I can't tell you how many times I've seen students with needle drivers up over their head, and that is no longer sterile. They need to be in front of you and below your shoulders. Okay, now it's time to tie your knot. Put your needle drivers back into that base position over the incision. It's okay to put the needle on the sterile field and hold the suture close enough for control, but not too close for making knots. Bring the suture around your needle drivers. Remember that the first suture is a surgeon's throw, which means we go around the needle drivers twice before pulling the knot through. As you pull the knot through, make sure you see a nice cute little pumpkin or like a nice knot form. And as you pull the suture tags, be sure you're pulling evenly above and below the suture, nice and flat to the patient in the same orientation that the suture went through the skin. Place your needle drivers back at base position over the center of the incision, and now wrap the suture around. You'll be coming around the opposite way than you were previously, and grab the tail, and then again pull the knot by pulling in equal and opposite directions in the orientation of the original suture. Add 2 additional throws for a total of 4 knots. Remember, the first knot is a surgeon's throw or a surgeon's knot, and then there are 3 square knots on top of that. So at a minimum, 4 knots to make a secure suture. Lift up the suture and cut them together, leaving approximately a centimeter of length so that when it comes time for suture removal, we can get these out again, keeping in mind most of our patients are extremely wiggly. For a simple interrupted pattern, you will continue to place these knots, spacing them out about 1 centimeter apart from one another. These guidelines may vary based on the individual circumstances of different incisions. In this video, I next demonstrate a cruciate mattress. Remember, a mattress pattern is really good for areas of tension when the edges of the incision are not right next to each other, and it's going to be a little tight to get it closed. With a cruciate suture, there are 2 bites taken before the knot is tied, and then this time when the knot is pulled tight, the ends are pulled in a diagonal along the cruciate, again flat to the patient with equal and opposite strength. I hope this video is helpful as you learn how to suture, and of course, if you're stuck or having issues, find someone to help and give you some feedback. Keep up the good work. You are doing great.